Hi, I'm Dr. Reginald Bell. I wanted to introduce you to myself, my practice, SurgOne Foregut Institute, let you know a little bit more about what we do and why we do it. I've been in practice for 25 years. I've had the good fortune to be able over the years to specialize my practice into kind of one area of expertise, which is what we call foregut surgery. Foregut is the upper part of the intestine, so it's the esophagus and the stomach. Probably the most common reason that we see patients is because they have problems with GERD, gastroesophageal reflux disease, heartburn, sometimes with hiatal hernias. We see patients not only from the local area, but from throughout Colorado and the Rocky Mountain region and from throughout the country.
So I would have to say the number one reason why patients come in and see Dr. Bell is his specialty and passion for esophageal and stomach disorders.
I came to one of Dr. Bell's seminars at Swedish, was very impressed with the breadth of treatments he was offering, the honest, forthright way he talked about that treatment.
We've really dedicated ourselves to having state-of-the-art technology, state-of-the-art diagnostic testing. So in our office, we're able to offer endoscopy without needing sedation. We do much of the testing here in our office instead of in the hospital, and so we have very good quality control because we know exactly why the patients are coming in, what they are doing. And most of the time I can see the patients immediately after that testing is done.
We also have an on-site therapy dog which helps a lot of patients with that anxiety and that anxiousness when it comes to some of the testing that we do here.
I think one thing that we provide that may be different than other practices is more of a calming environment. The confidence that Dr. Bell alludes and the practice alludes, I think, makes people feel a little more at ease.
Everyone is so warm and so kind, so inviting, very reassuring. They take good care of you.
When you have surgery, Dr. Bell is the only one that does surgery. When you have follow-up, it's either Dr. Bell or myself that will see you in follow-up. So we know our patients, we know them by name, not by disease, and we follow up with patients frequently. Once you have surgery with us, I tell patients you're kind of ours for life. So if you have any issues or concerns, whether it be 2 weeks, 2 years, 10 years down the road, we want to hear from you.
We've been involved in clinical research, so we've really been on the forefront of these new technologies. And we continue to engage in clinical research which benefits our patients and benefits medicine as a whole.
The treatment I received from Dr. Bell and his staff was first rate. They really know their stuff. Their diagnostics were extremely thorough and very modern and high-tech, so we knew exactly what my problems were. The surgery addressed that, and I'm just a happy camper 10 months later.
We often see patients who drive in from a long distance away or fly in, and our office has really tried to fine-tune things to minimize the number of visits that they may need to make. Part of the reason that we see these patients is because indeed we have specialized in this, and we really feel like this is an important endeavor.
It happened very quickly. He was so accessible, so easy. Dr. Bell had a visit with me and said, "You have achalasia, and this is how we think it should be fixed. It's the best procedure that is available." The next week, he did the myotomy.
Oftentimes, patients come to see us out of desperation. They may have been placed on medication and told that they need to stay on medication the rest of their life and live with their symptoms. That's not the case. And frequently, by coming to see us, we're able to arrive at a diagnosis and a treatment method that can significantly improve how they feel, oftentimes enable them to get off their medication and go back to living a normal life.
You know, one of the things with the gastroenterologist that I was going to had told me that I'll be on PPIs for the remainder of my life, and that surgery wasn't a good option because the outcomes weren't that good. Of course, with Dr. Bell, that certainly was different, and and having a procedure that I had through them changed my life. And things have been amazing ever since. It's like a new lease on life.
As someone who suffered from GERD for many years, I can understand what patients go through, how uncomfortable they feel, how much it can disrupt the quality of their life. In preparation for the surgery, I went through all the testing that we sometimes ask patients to go through prior to their surgery. So every test that we may ask a patient to have, I have had. I also know what it's like to have surgery, to recover from surgery, and how nice it feels to have had the surgery and be free of my symptoms.
The testing, I thought was going to be, I was really nervous about the testing, but Dr. Bell talked me through it, and I thought it would be a lot worse than what it was going to be, but he made me feel much more comfortable.
Treating reflux is a reconstructive procedure. I've been doing this for 25 years, and over the years I've been able to develop better techniques. We continue to follow our patients so that we can improve and fine-tune our techniques based on how patients have done. Most of all, it's that experience and dedication to one specific field that's reconstructive that I think is what sets us apart from most other surgeons.
You know, what they do is, it is life-changing, and that is, I mean, you can't say enough about that. I have other family members that suffer from it, and I'm certain they'll be here to get surgery if when it comes to, you know, them having to do that. It's an amazing change in your life. So.